welcome to MedSynapse podcast series. I'm your host, Dr. Nigar, and today we will be discussing on a very crucial topic, the relationship between dietary sodium and hypertension. Joining us today is our esteemed guest, Dr. Revolution Shrestha, a distinguished general practitioner with over 5 years of experience in healthcare. Dr. Revolution has practiced medicine in various countries, including UAE, Nepal, and Philippines. Currently pursuing a master's in public health, Dr. Revolution is a highly regarded general practitioner who will provide valuable insights into the impact of dietary sodium on hypertension in today's discussion. Welcome, Doctor.
Thank you, Dr. Nigar, for the lovely introduction, and thank you for inviting me to join on the MedSynapse platform. I hope today would be something productive for us, for every people watching the podcast.
Thank you so much for your time and for joining us today on this important topic. Without further delay, let's dive right into our conversation. To begin with, how does dietary sodium intake relate to hypertension? And what's the mechanism behind this connection?
So to understand the dietary sodium intake, because most of us, a general population, we do not know what sodium really is. So we think that salt that you use at the home, that is considered sodium. But in fact, that is only 60% of the sodium, and the 40% of it is mostly chloride. So people think sodium only comes in the table salt form, but it can come in many different forms. That we'll be talking in later part of the podcast. But for the meantime, how sodium causes hypertension is that when you take some diet that is very high in salt, meaning sodium. So we have this general principle that wherever the sodium goes, the water follows. So when you take a high sodium diet, initially your kidneys will be able to compensate for this and they will excrete out the sodium along with the water. But when there is an overload, what happens is like along with the sodium, the water starts getting retention. So once there is retention, there will be increase in cardiac output, and in the long term, there will be increase in total peripheral resistance. So both of the things can significantly impair the blood pressure of a normal individual.
Now, sodium sensitivity plays a significant role in blood pressure regulation and has important implications for managing hypertension. Could you explain the concept of the sodium sensitivity of blood pressure and its implications?
Okay, so basically what we mean by sodium sensitivity means you always hear some people or some patient come to you and say I have a friend, he does the same thing that I do, but he doesn't have these blood pressure issues. But me, I'm just doing the same as him, but why am I getting this blood pressure issue? So this is where a role of sodium sensitivity also comes in. So sodium sensitivity basically means it's a sensitivity of the blood pressure that changes, that fluctuates with your sodium intake. So basically what we usually do is when to check for the sodium sensitivity, they have this step that they will put you on a low sodium diet for a few days and they'll put you on a high sodium diet for a few days and see if there is variance in the BP. So if there is variance in BP, meaning that yes, you are sodium sensitive. So usually populations, African American, Asian, old age people, women, they tend to have more sodium sensitivity. So you tend to get more blood pressure in these populations as well.
Now, staying informed about recommended sodium intake guidelines is essential for healthcare professionals and individuals with hypertension. What are the current recommended guidelines for sodium intake, and how do these guidelines differ for general population and individuals with hypertension?
So according to the current American Heart Association guidelines, right now the recommended sodium intake for a normal individual is around less than 2,300 milligrams. So that is only it's only a teaspoon of the salt. So normal consumption these days for people is more than 3,000 to 4,000 milligrams per day. If people has hypertension, if they are more than 51 years of age, they have diabetes or chronic kidney disease, the AHA recommends lowering it down to less than 1,500 milligrams per day. So these are the recommendations. However, it is important to know that it doesn't mean you have to take 1500 milligrams per day, because your body basically, if you only take 500 milligrams per day, your body will function just fine. So these are the recommendations, but you can of course choose to go as low as possible, maybe 600 or maybe 700 if possible for you.
Now, in practical terms, what are some common sources of excessive dietary sodium that both healthcare professionals and patients should be aware of?
So when we talk about where does this sodium come from? So one of the most important thing that I always tell my patients is 70% of the sodium that we consume comes from the food that we eat outside. Because when you go eat outside, you do not have control on what you are eating. In the restaurants, salt, MSG, soy sauce, vinegar sauce, all these condiments are used to make the food more tastier. You'll be enjoying it, but at the same time, your body would not really be enjoying it. So that is one of the main sources. And besides that, there are other sources that usually the table salt that you use at home. The other sources can be from this pizza, burgers, French fries with all the salt toppings that we usually take. So these are the basic main sources of sodium for human beings. And besides that, the other sources are usually these packed items. So usually people who do not have time to cook, what we usually do is maybe on the quick go we make a noodle. So we forget to see the labeling on the noodle, like a single pack of noodle contains more than 900 milligrams of sodium. So just imagine like the content, how much it adds up over the time. So yeah, these are the main sources. Of course, there can be a few sodium sources in sometimes the medications that you take, even basic omelets that you make at home, you put a little bit salt to make it more tastier. So these are basically the bottom line is 70% comes from the packed and processed foods along with the food that you usually consume outside.
Now, are there specific patient populations that might be more sensitive to the effects of dietary sodium on blood pressure?
Yeah, actually, a while back when we talked about sodium sensitivity, so there are some certain populations that are more sodium sensitive. Like we said, someone from African American descent, maybe an Asian population, older people, female age, and also people with high blood pressure. They tend to have like sodium sensitivity more compared to the people who are normotensive. So these people are usually more sodium sensitive, so they are more prone to getting hypertension on the long run.
A lot of doctors advise reducing sodium intake in managing hypertension. How does reducing sodium intake contribute to hypertension management, and what are some strategies to help patients lower their sodium consumption?
So what I usually do in my practice is when a patient comes in, so it is very important that you do not force your idea or things that you have learned on a patient, because when you try to force something on someone, it will not go down easily. So what you have to do is you have to understand them, that what they are taking. You have to make them aware that what they are taking, how it is affecting them. So basically we say education here and there, but educating in a proper way is very important. So what I usually do in my practice is when a patient comes in with a high blood pressure, so I ask them, okay, what are your usual diet? What is everyday diet that you are taking? So from there, I try to give them an example. Like, for example, let's say if I have a Filipino patient coming to me and they are very fond of this soy sauce. So when you look at the soy sauce labeling, I open the labeling to them and say, look at the soy sauce that you are consuming. One soy sauce, only this much of soy sauce has more than 800 milligrams of sugar. So you are taking medications to reduce the blood pressure, but at the same time, you are taking this thing that will cause increase in the blood pressure. So on the long run, basically it's a waste of money if you are taking the medication, but you're not modifying your diet as well. And besides that, we can also tell, of course, like I said, 70% comes from the food outside. So you can reduce eating outside, you'll save money that way as well. And also, like when you're eating outside, you can actually tell them, like, I don't want any salt in my food. I just want extra salt. So you can just sprinkle a little bit for the taste, and try to avoid these packed items. And reading the labeling of the food is very important, because most of the people, even me myself, few years back, I didn't know like what this labeling really meant. So it's later, like once I started looking at the labeling, then my perception on whole thing completely changed. So it is important for the patients to understand that as well, because there are many alternative foods available that has low sodium content. There are many foods that are very high sodium. People think like, I'm not taking sodium, I should be okay. But actually this sodium are coming in very much hidden forms, that it is impacting the blood pressure of patients in the long term as well.
Especially when the patients are used to having some product for a long time, like how to say, like they're kind of addicted to that. So even when we say it, they're still subconsciously addicted to that product, and they will still go buy it. So unfortunately for some patients, limiting sodium means just cutting off salt from the diet, the table salt. Right?
Yeah, I agree. Yeah, for most of the people, it's like that. When I say you have to reduce salt, they'll say like, I'm not using that much of salt. Yeah, I do get that often as well.
Exactly. Now, are there any controversies or differing viewpoints within the medical community regarding the relationship between sodium and hypertension?
Between sodium and hypertension, as of now, I do not think that there are any controversies that there is a direct correlation between sodium intake and the blood pressure itself. But however, there are controversies regarding this salt sensitivity, and there are controversies regarding the BP monitoring and the recommended doses of salt intake in different populations. So when we talk about the general consensus of sodium and blood pressure, the correlation, it's there. So there is no second, what do you call, the bias or whatever second opinion that you can get between sodium and the hypertension itself.
Moving on to our next question. Effective patient education and motivation are critical for achieving dietary changes related to sodium intake. For healthcare professionals counseling patients, what are some effective ways to educate and motivate the patients to make dietary changes related to sodium intake?
So in hypertension, what we have, this recommendation is DAS diet. We call it dietary approach to stop hypertension. So DAS diet, actually, in a lot of studies, it has shown that within a week, it can drastically improve your blood pressure. These days, even the cardiologists themselves, they have like, I have personally talked to a few cardiologists, they have told me that even if the BP is in the ranges of 140 or 150, they do not want to start the medication, because when you follow this DAS diet pattern, you can reduce your BP almost by 10 to 14 millimeters of mercury. So what DAS diet usually means is that incorporating diet that are rich in fruits, vegetables, whole grains, low fat products, and avoiding some red meat items, saturated fats, trans fats, and sweets and sugar in the food. So when you focus more on fruits, vegetables, low fat diets, this chicken, poultry, nuts and legumes, you tend to have a better blood pressure control compared to the diet that you have usually with fats and red meat and sweets and sugar. So usually for people with hypertension, DAS diet is very, very effective.
Lastly, are there any emerging research trends or advancements in our understanding of hypertension and sodium intake that healthcare professionals should be aware of?
And this question, I must say, like, this question is a very, very good question, because usually as a healthcare professional, we usually tend to get stuck with the traditional medicine that is like currently we are following from the guidelines and book, but we fail to look at the advancement that is coming in the future or that is happening as we are currently practicing medicine. So yes, right now, even me, I was surprised to hear some of the technologies that has come, some of the medications that has come. So of course, there are some ways, like before we used to say it's best if you have your BP is less than 130s, or less than 140, 130 to 140 millimeters of mercury systolic blood pressure was acceptable. But recently there has been these studies saying that when you control your BP in the ranges of between 120 to 130, in between them, you tend to have very much lower risk of having heart attacks, stroke, and other risks as well. There is another thing that has recently come in the market as well. This is one of the medication. I'm not really sure of I think it was Baxdrostat or something. That's one kind of medication. So that usually what it does, it works against the aldosterone. So aldosterone is basically what pulls the sodium inside your body. So what it does, it acts against aldosterone. So that way, even with patients with very much resistant hypertension, meaning the BP is not getting controlled even with 3 or 4 medications. So this medication right now, it has shown in some of the studies that it can reduce the blood pressure even in cases of treatment resistant hypertension. And there is also this another new thing that has come. The studies are actually coming more since 2020. I think there are some paper published on this. This is something called renal denervation therapy. So basically, the renal denervation therapy means it's just like the nerve supply of the kidneys are basically, you go through the femoral line, you enter the renal artery, then from there you put an ultrasound wave to disintegrate the renal nerves. So this also has shown effect. This also has shown that a lot of people with treatment-resistant hypertension are benefiting from this kind of treatment. So these are some of the newest trends that I know about as of now. But maybe something better will come in the future as well.
Dr. Revolution, we want to express our sincere gratitude for your active participation and for your expertise in today's discussion. Thank you so much for your time and for contributing to sharing knowledge on our platform.
Thank you so much for having me as well, and it's always a pleasure to talk to you. And I hope this podcast will be helping some people with hypertension, or maybe some medical professionals to look into the new researches and new trends and new medications, so we can keep on innovating.
Thank you so much once again, Doctor, and looking forward to many more podcasts together.
Thank you for inviting as well.
And to all our listeners out there, if you have enjoyed this episode and want to stay updated with the latest videos and medical discussions led by our expert doctors, we encourage you to like, subscribe, and register on our MedSynapse website. Until next time, thank you, goodbye, and stay well.